Hello and welcome to Moneyline with me, Nnaji. Let me join the rest of the world to ring the Happy New Year bell to all our viewers as I begin the first live show for this year today. What a year 2020 was to a lot of us. It was a year a lot of persons anticipated and longed to see their dreams come true. Even governments had their administration performances benchmarked on the year 2020. However, 2020 came with a lot of shock waves with the pandemic that threatened lives, livelihoods, economy, social interactions, and a plethora of challenges. Some may arguably say that 2020 was the best year, or was their best year so far, while some are picking up the pieces of their lives. Wherever you may find yourself on the spectrum of experience for the past year, what should ring true at this moment is that we are here now, a new year, a blank canvas to draw new visions, set new goals, and experience new things. Though we are still going through the pandemic, with lives still being lost, even as I speak, we cannot forget to stay socially conscious and maintain a sense of social responsibility to one another. Before the new year, and even after we said our Happy New Year, the Moneyline with Nancy family lost very dear friends in our community due to COVID-19 complications. Ubon King, of course, for those that watch the program, Ubon King was a business analyst here on the show. And just 2 days ago, Professor Ebere Omudiwe, an economic analyst, an astute scholar, died due to COVID-19 complications. These men touched the lives of people with their experiences and insights. Today, we remember them and they will forever live in our hearts and minds. We commiserate with their families and extend love and light to them. To some, the death toll arising from the pandemic is just numbers or not even real at all. However, these are not just numbers. These are people who really have loved ones, and we're saying that not just loved ones, associates as well as friends, and these people who have lives that are dependent on them and whose lives may never be the same again because of their demise. In this new year, I hope we all see a government that listens to the voices of the people. I hope we have governments across board build back the trust of our people and confidence in their ability to provide the leadership and results that we want to see. Last year, we all witnessed events that rocked the boat of our dear country and left the taste in our mouths. From the inconsistencies in the sharing of COVID-19 palliatives meant for the people, to the handling of the NSAS protest, to the rise in insecurity in our country as Nigeria is the third most terrorized country in the world, according to the Global Terrorism Index at 2020. No doubt we are in precarious times and Nigeria is faced with a lot of issues that all need to be addressed. However, the government should not forget that it starts with the people and ends with the people. And so the focus should be what will make the lives of Nigerians easier and better this year. The NIN as well as SIM card linkage policy, that's the NIN registration and SIM card linkage policy, in the middle of a pandemic doesn't seem like it, or it doesn't seem like a well-thought-out policy and making things easier for Nigerians. Yes, we have transitioned into the new year. Let's not forget that we are still dealing with a pandemic. Our country is still reeling from the effects of the first wave and battling a second wave that seemed to be more aggressive than what we've experienced in the past year. Let's be our brother's keepers. Let's make better decisions that necessitate better actions. Let's live responsibly and follow the set rules that can help slow down the virus in our respective communities. Wear a mask. Just like as I'm with here, after the show, my mask is here, I'm going to put it on. Maintain physical distance. Wash or sanitize your hands frequently. Avoid large gatherings. Let's follow the protocols so that we can all be safe to build back our economy. The health of Nigerians matter and the wealth of Nigeria matters. Let's all stay alive in health and in wealth. I'm happy to be back this new year. It's been a minute and I hope you stay with us through the year. So Happy New Year again. Let's quickly take a break, and when we come back from the break, I will be delving into my first conversation this year. And it's logical because when I was thinking through what I was going to do this year, or how I'm going to start my show this year, the most logical thing to do was to take a look at COVID-19 and Nigeria in 2021, because COVID-19 is still a risk. Dr. Sani Aliyu, the National Coordinator of Presidential Task Force Against COVID-19, will be joining me shortly. Let's quickly take a break. We'll be right back. Prof, how do you think we can lift the bottom millions with living with income inequality out?
Yes, I think that what we can do, as you said, is some of the things that I've said. We have to expand the economy. Okay. You know, because if you don't expand the economy, the people won't have opportunities to have a job that will lift them up. But another thing is these other investments I said you should do. You know, when you invest in education, you create jobs in that sector. When you invest in health, you create jobs in the medical sector. So these things have multiplier effect. And so government the most primary thing is to come out and say, and Buhari himself has the image that fits this, to come out and say, look, this nonsense must stop.
All right, welcome back to the program. Earlier on, I did say that my guest will join me after the break. He's here now, Dr. Sani Aliyu, who is the National Coordinator, Presidential Task Force on COVID-19. He was the former Director General, National Agency for the Control of AIDS, that is NACA. Welcome, Dr. Aliyu, and a Happy New Year to you. Would it really be right to say a Happy New Year for us Nigerians? Because I actually thought that the worst was over for the country, even as we went home or as we approached the festive season, though a lot of us threw cautions to the wind. For those of us that were even still wearing masks, when I find myself out, I wear mask, I seem to be like the odd one out, or people will like, what is she wearing mask? But that's the COVID-19. Would you really say that is indeed a Happy New Year for us as Nigerians as we, come back into the new year?
Well, I'm afraid it's been a Merry Christmas for the coronavirus. Honestly, it's had the opportunity it hasn't had before to really spread this time around. As you said, most of us were confident that the worst was over. But 9 months of hard work, 9 months of convincing the public that this is serious has been washed away, taken away by just a few weeks of merriment. What we are seeing, no doubt, is the impact of the mass gathering events that we've had over the last 1 month in December. And it's going to get worse before it gets better, I'm afraid, because we are always lagging behind. The incubation period for coronavirus is up to 2 weeks. The death rates usually reflect we're about 2 to 3 weeks behind when it comes to the death rates, because usually it takes about 2 to 3 weeks before people really go into extremes and die. I think it's most unfortunate that we've gone into a second wave, and a second wave that appears to be even more deadly than the first one.
What does that second wave mean? That should be the B part of my question. The A part of my question, just like you said, is it was a Merry Christmas for COVID-19 itself as a disease. Was it as a result, the rise we saw, is it as a result of the mass gatherings that we've seen, at least we saw in the last 2-3 months, or is it as a result of the new strain that also came in with people from abroad?
So we certainly can't exclude that. At the moment we are looking at the current strains we had. We did do, the last time we did genotyping was in September, October, and at the time there was no evidence that we've got the new strain. But as we know, coronavirus infections have been very successful when it comes to spreading across the globe. Even countries that have had fairly strict measures, such as Japan, such as China, etc., are now having emerging infections. But the reason why people go into lockdown or apply these non-pharmaceutical interventions is because we know the virus cannot fly from me to you. So, for example, now that we are on, I'm sure people will be wondering, why are we not wearing masks? The reason is because we've maintained that distance. It's a droplet infection. So even if I cough at you from this distance, it's not going to reach you. It will settle on the surfaces. Exactly. It's a virus that has never really gone away. The lowest count we've had since March, April has been around 80 cases a day. So it really hasn't disappeared, and for every 1 positive case we get, we are probably missing around 10. So if you look at our numbers there, for instance, 100,000 confirmed cases, the likelihood is we've had more than 1 million cases of COVID-19.
Is it because we're not testing?
We're not testing. We're now testing a lot more. We don't have the
capacity to test a lot more, or Nigerians would have the virus and will have the infection, or will have the symptoms and not go for testing?
So both. In fact, at the beginning, what we had was a paucity of laboratories. Since then, we've expanded our laboratory base. We have more than 70 public laboratories and about 30 private laboratories. So in terms of capacity, we do have testing capacity. We've never exceeded our testing capacity, which at the moment is about 15,000 tests a day. We're testing a lot more now. We're testing about up to 6,500 samples per day, whereas in the past we were testing about 1,000, 1,500.
That's across the country?
Across the country, yes. It's still insufficient. I completely agree with you. It's insufficient. But part of the reason, certainly back in September, October, was that people were failing to come out. They were having the symptoms but were refusing to come out, maybe because of fear, because of stigma, etc. And we are still having situations where doctors who should know better know that COVID is around. You have a patient who's having a persistent fever for 2 weeks, respiratory symptoms. You keep him in your private hospital. You don't test him for COVID. You treat him for malaria and typhoid. And it's not malaria and typhoid, and it's only much later on when they start losing their oxygen saturation. That's when it clicks, and then you start running around looking for a test. So it's a combination. We need to do more public enlightenment, but we also need to encourage people to come out and test. If you have those symptoms, you really should come out, not only for your sake. If you're a young person, you would survive it. The likelihood is you'll survive it. But you
the second wave seems to be more aggressive, and it's from all indications and from what I've read, it's seemingly not even leaving the young people.
Yes,
alone.
so far.
Okay, what do we mean by young people, though? Because I also see between the ages of 35 to 40, also casualties of death.
Yes.
COVID-19 death. So when we mean young people now, what age group are we looking at?
So when we talk about the elderly, we talk about those above the age of 60 here. But young people have always been affected. The majority of cases we've had in Nigeria have been between the ages of 30 to 40 years. The majority of the young people will be fine. They will survive it.
So, sorry, I just needed us to, between 30 to 40, are they asymptomatic?
Most of them will be asymptomatic.
Okay, I needed us to...
Yeah, most of them will be asymptomatic, that's right, between the ages of 30 to 40. But the youngest person who died in FCT, and this was back in April, May, was just 39 years old. And that's where the problem is with COVID, Nancy. You just don't know whether are you going to fall within the mild spectrum or the really severe spectrum, or in between. You just don't know. And there's no predictive factor other than the comorbidities. Age is the strongest predictive factor, because when we look at those between the ages of 50 to 59, between 19 to 23% of them died. Based on our data.
That's a lot.
Yeah, it's a lot. It's a lot. So when people in Nigeria say to me that actually people are not dying of COVID, that our mortality rate is low compared to abroad, for instance, I say to them, no. If you are young, yes, but anywhere you are in the world, if you are young and you catch COVID, you're likely to survive from it. But if you are above the age of 50, you catch COVID in Nigeria, you are more likely to die here than in most parts of the world. Maybe because of the issues of health infrastructure, the easier availability of oxygen, etc. Yesterday I was at Gwagwalada to do a quick inspection because we were having problems with bed space in Abuja. They have 30 beds. They had 36 patients. This morning I had a patient who needed oxygen. And Gwagwalada is the main tertiary care level 3 facility where we intubate and ventilate. And we were struggling. This lady, we couldn't get her in. So she's still in a private hospital getting oxygen. She's even lucky she's in a private hospital that's ready to keep her there and give her oxygen.
At a cost?
Of course, at a cost. But some private hospitals actually chuck the patients out. The moment you're diagnosed with COVID, they ask you to leave and go to a treatment center. So what we're trying to say here is, do not catch COVID. Do whatever you can, especially if you fall within the high-risk groups. And if you fall within the high-risk groups, now is the time to lock yourself up. Because it wasn't even March, April. What we were worried about in March, April is starting to manifest now. And I'm not trying to cause a panicky situation. This is the fact, Nancy.
If we take a look at the public facilities which you talked about earlier, for the testing of COVID, or for COVID, does it come at a cost? Because I've heard a lot of things that to test for COVID now you have to pay. Not just even in the private facilities, that government officials asking for money.
Any government official asking for money for public health testing should be arrested. Because we provide the laboratories with reagents for free through the NCDC. The healthcare workers are there, the laboratory workers are there. States are responsible for testing. But as far as the public sector is concerned, it's free. It's when you are traveling. And the reason why we put travel, two reasons really. First of all, travel is a personal pursuit wherever you are in the world. Secondly, if we took up travel because of the number of passengers we have coming in and out of the country, the current kits will be consuming about 500,000 test kits every month. And I won't tell you, but it's a lot of money per each test kit.
You should tell me, I'm the money woman.
It's more than 18,000 naira for a test kit, yeah, in the public sector for PCR.
So if we have 18,000 times 500,000, that's
yeah. So we were with PTF, we put in a budget of 1 million test kits. That's 18 billion naira, and so far we've tested more than. As you can see from the big figures, we've tested more than a million persons, even though a large chunk of that was contributed by our donors. But what I'm trying to say is it's unaffordable for government to pay for travel. And even if you go to the UK, for instance, you are traveling, you will pay for the COVID PCR test. So, but for the public sector, it's very important for people to realize it is free. It's the only way we can get on top of the infection, to know exactly what the problem is. The states are supposed to be taking up the testing. We've just introduced a new project where we want the states to test 450 samples in each local government area over a 2-week period. There are states that have tested less than 500 since the start of the epidemic. And look at the figure, 1 million tests. And some states are taking up less than half a thousand of those tests. And those states cannot tell me that they don't have COVID, because COVID does not respect borders. So testing is crucial, but just as important, people need to know the symptoms. If you have a fever that's persistent, it's probably not malaria or typhoid. It's fine to check for malaria, typhoid, but if you have respiratory symptoms with it, look for COVID.
What kind
if you
of
have a loss,
symptoms are you talking about?
So cough, sore throat. But interestingly, one symptom that has become really obvious is the loss of smell, loss of taste. So if you put on your perfume every day, and one day you put on your perfume and you can't smell it, go for a COVID test, because it may actually be the first manifestation of COVID. The second thing I wanted to say is, in terms of protection, Nancy, always assume that whoever you meet might have COVID. It's the best way to protect yourself. That way you've psyched yourself up. Your risk perception is very high, and you will protect yourself.
For those of us that do it, they think we're absolutely crazy.
Hopefully we will survive.
They call me COVID police.
Yeah, and no, hopefully we'll survive. Of course, there's nothing absolute. It doesn't mean that 100% we are protected, but at least to a large extent, it will work just as well as having a COVID vaccine.
Let's talk about the big issue, the vaccine. When are we expecting it into the country? And when it comes in, who are those that will get it? I know I've listened to what's the PTF, some of your press briefings, and 100,000 doses. I can imagine that those 100,000 doses will go to those of you within the corridors of power.
Well, Nancy, I'm not sure I'm in the corridor of power.
You are in the corridor. You are the national
I'm not sure that is true.
Did you hear it? Presidential?
I'm not sure that's true, Nancy. So our priorities, the 100,000 is just a drop in the ocean. Most of the vaccine arrangements in the developing world is being done by Gavi. That's the Global Alliance of Vaccine Initiative. And so far, they've been able to secure 2 billion doses worldwide that they will share among developing countries. And as you're aware, some of the developed countries like the UK, US, Canada, for instance, they have bought more than what they need for their population. So the likelihood is there will be an excess of vaccines, and that excess of vaccines will not go to individual countries. They will probably move them to Gavi. Gavi have given us, so far, the negotiation is that they will provide us with 20% of our population in 2021. So that's about 42 million. About 40 million doses. Actually 40 million Nigerians really, because it's 20% of the population.
At a cost, or is it free?
So that will be free. That 20%, and they're giving us 100,000, as you said, as part of that 20%, just as the first go in at the end of January, with 20% in the first quarter to second quarter of 2021. Nigeria would be expected, the government will be expected to pay for the logistics of transporting the vaccines and also administering them, and also paying for the healthcare workers, the logistics, etc., and the refrigeration. That will be taken care of by government. In addition to that, government will be expected to buy 20% more from Gavi of the vaccine, but that 20% will still be at a reduced cost compared to what we will get if we were negotiating directly.
With the companies?
Yeah, from the companies. It will be substantially less.
Do you know how much there will be government will be buying from Gavi?
No,
because
I don't have the exact figure.
Because for example, the AstraZeneca, Pfizer, I think Pfizer is the most expensive.
Moderna is the most expensive.
Most expensive Pfizer.
Yeah.
Then, but it ranges between at least $15 to $35, $40 for the three.
I'm sure the Gavi, I can't say so, but I'm sure it's below $10. Yeah, it's below $10. The majority, I'm just saying this because I haven't checked with the head of primary healthcare, but my view is the majority of the vaccine will probably be the Oxford AstraZeneca vaccine, because that's the one that has the most favorable temperature conditions that we can maintain. Yeah, but one of the conditions that Gavi have given us is, as a country, we need to sign up to accepting multiple different regimes because of the issue of supply chain. So there will be some Pfizer, there will be some Moderna, there will be some Oxford, but the vast majority will be the Oxford AstraZeneca vaccine. So if we have that first 100,000 coming in, the priority is actually not government officials, unless they are elderly. So the priority number one are our healthcare workers. because they are the ones at the front line. They are the ones most likely to catch COVID, and they are the ones that we need to look after, because if you don't have a doctor looking after a COVID patient, if you don't have a consultant anesthetist, and we have very few anesthetic consultants that can intubate, etc. Because Nancy, you wouldn't want me to intubate you, not that I would want to, but I don't have the skills to intubate. It's a highly skilled. So those are the priorities first. The second priority are those that are elderly.
In this same 100,000? Or the ones that are coming?
The 20% that will be coming. Well, the 40% in 2021. Yeah, but the 100,000.
That's a long time
so
to get our citizens vaccinated. So between now and 2020, for those that agree to be vaccinated, I'll come back to the conspiracy theories later. In this 100,000 that will be coming by the end of this month, are the 2 doses part of the 100,000?
So
because
the 2 doses,
for those vaccines, they are supposed to be 2 doses. J&J, Johnson & Johnson, I guess
the single dose. Yeah.
Single dose, yes.
So we're really looking forward to a single dose, because personally, I think a single dose is what we should be applying. But
for costs, and logistics.
For cost and logistics, and you don't need to chase a person again, and we don't need to maintain a data system that is extremely robust to be able to trace the people for the second dose. But you're quite right. So the 100,000 is just a taster, but it's a taster that will go very far in terms of our healthcare personnel. Our priority really are our healthcare personnel, then followed by the elderly, then followed by those with comorbidities, diabetes, hypertension, etc. Those that are most likely to die.
So how would you get that data? Do we have the data of our elderly and our seniors?
So actually we do. The National Bureau of Statistics is pretty good. Primary healthcare, they've been working day and night over the last few weeks. They have a very large committee with subgroups that have been working, looking at every single aspect, right from who's going to have the vaccine to where are they, to looking at the database for the primary healthcare, the general hospitals, etc. And remember, some of the general hospitals, we have diabetic clinics, we have hypertensive clinics where large numbers of people, if you go to Kano, for instance, the diabetic clinic, it's huge. People come in every day in the morning to be seen, and they all have diabetes. So you just target that group, and when you go in, you take the data and you provide them with the vaccination. The vaccination is really important that we get on to do it. I'm pleased that the 100,000 are coming in, because at least it will prepare us, it will provide us with a sort of simulation for the big job that is going to come later on. But you're quite right. To me, the biggest challenge, Nancy, it's not even going to be how to administer the vaccine. It's whether people are going to accept the vaccine.
Now, the next question will be, from this 100,000 doses that are coming, will President Buhari and his vice, Professor Shibaju, take it publicly, just like we've seen recently? I think 2 days ago, I saw Prime Minister Benjamin Netanyahu of Israel take his publicly. VP Pence of the US has taken publicly. Dr. Anthony Fauci of the US took publicly. Even with all of that, you still see that there are conspiracy theories around the COVID-19 vaccine. Why? Because people, and for me, I was actually also surprised. I said, this is the fastest vaccine in human history that has been, gotten. So does it also undermine the safety? Because people are saying, how can they, but other diseases have been ravaging us. Why can't they get cancer vaccine? Why can't they get this? And COVID-19 vaccine, within a space of 6, 7, 8 months, 9 months, within the space of 1 year, at least from Wuhan 2019 till now. So I've asked you 2 questions. I'm trying to get
so let's look at the argument about the duration of the trials. Nancy, the advent of the coronavirus vaccine is a triumph of science against disease. There's no doubt. COVID has been devastating because it hasn't just been a health problem, it's been a huge economic problem. You're doing MONEYLINE, so I don't want to quote figures, but some countries have as much as a 20% drop in their GDP. Because of, if you look at the UK, they've lost almost 19 years of growth because of COVID. These countries cannot sit down and allow a disease condition to ravage them and destroy their economy. The reason why they are sophisticated in terms of their health system, etc., is because of the resources they have. So if those resources are destroyed, their people are unemployed, they are dying, etc., they are not going to sit down and watch it. So a lot of resources went into the science, but even before the science came in, even before COVID came in, the science of messenger RNA vaccines, DNA vaccines, etc., had already been developed, partly because of Ebola. Issues, etc. When people talk to me about how quickly they were able to license these, it's all about the number of people you can engage in a clinical trial. It's the number of what we call the power of the study. Phase 1, Phase 2, Phase 3 trials took place, but there was no shortage of volunteers. There was no shortage of people who had COVID. There was no shortage of people who were catching COVID. There was no shortage of people who were at risk of catching COVID. And all you needed to demonstrate is, if I give this vaccine, fewer people will catch it compared to those that had placebo, the inactive component. Developed countries, Nancy, they will never produce something that would harm their communities or their countrymen and women. They wouldn't. So I find it really silly from the social media side. All this fake news about vaccines being introduced into Africa for reproduction purposes, etc. We know in the past there have been experiences that have been pretty bad for us, like in the US, the Milwaukee experience, for instance, where they gave syphilis and they were given syphilis treatment, or even the more recent Pfizer one in Kano, which was most unfortunate. But that doesn't mean that whatever comes in from abroad is going to harm us. People talk about the vaccine coming in. Meanwhile, even infant formula, we buy it from abroad. Our clothes, we buy it from abroad. Food, we import. Drugs, antimalarials, antibiotics, they're all from abroad. So why are you taking antimalarials if you think that it's going to harm you? So this debate needs to continue, but more importantly, people need to realize that if they want to survive this COVID, if we want to get rid of this epidemic, it's a mixture of vaccination and following the non-pharmaceutical interventions. Otherwise, the rest of the world, Nancy, will sort out this problem. By the end of 2021, UK have already announced by August, they intend everybody in the UK above the age of 18 would have had a vaccine. You will not be able to travel. You will not be able to do any business outside. Very few people would want to come into a country. So
there may be a risk that COVID. Africa would be the continent that everyone is looking at that may be dealing with COVID-19, even when the rest of the world has
yes, and that's why we cannot afford this. And please, organizations like Gavi, for instance, WHO, are really pushing for the vaccines to be available. But it's one thing for the vaccines to be available, it's another for people to be convinced to take it.
Will the president take it live and his vice president?
It's a personal decision, but I'm very sure he will. He has been very supportive.
Are you advising him to do that, just like other leaders have done?
I'm sure we don't even need to advise him. I'm sure Mr. President will do the right thing, just like Mr. Vice President will, just like the Senate President will, just like our political leaders, because it sends the right message out. Our religious leaders, our traditional rulers. And by the way, Nancy, I can't wait to take mine.
And even some of the big men, in quotes, have started going outside the shores of Nigeria to take it.
Well, it's survival. It's survival.
Why? Because they have the means.
Well, it's survival.
They are leaving the rest of us to our...
But it shows...
to attend to Israel.
But it's also sending out the right message as well, that there is nothing harmful about this vaccine that people should be afraid of. It's always a harm-benefit analysis. And at the end of the day, you're better off taking the vaccine if you need it. We're not going to give young people the vaccine. We're covering 70% of our population.
You're not going to give young people first.
Well, we're covering 70%.
Because I would like to take the vaccine. I will take the vaccine if it's available.
Yes, and I'm glad you classify yourself as young. I wouldn't call myself young.
But I'm not... okay, let me put it this way. I'm not within the ages of 15 to 25 or 15 to 35. Let me put it that way, because when it comes to a young definition in Nigeria, it is somehow twisted. Even for a man of 50, we say I'm a young man. I'm not.
Yes. I'm 50, and I certainly wouldn't call myself young.
But when the vaccine comes out, I would like to take it because I'm off the bracket of 15 to 35.
Yes. So when I say young, I'm actually referring to those below the age of 18. So the vaccines generally are not licensed to those below the age of 18. And remember, we said 2021.
So my
we
young
intend to
boy
cover
at
40%.
home, my son would not take the vaccine. There's no need for him to.
No, there's no need if he's even outside the country.
If he's available?
Even in the UK, they don't vaccinate those below the age of 18. They don't. So as I said, we intend to cover 40% of the population in 2021, 30% in 2022. That's 70%. The rest, once you achieve herd immunity, 70% plus those that have had natural infection, it's very likely the pandemic will wane. But Nancy, what we don't want it's a situation where there are so many people in Nigeria that have not been vaccinated. The rest of the region, everybody has sorted, the rest of the countries have sorted themselves out, and Nigeria becomes endemic for COVID. It will really put us on the wrong footing with the rest of the world.
Will there be a need for those who have tested positive for COVID-19 to take the vaccine again when it comes? For those that have tested, for those that survived COVID-19, should they take the vaccine again?
Absolutely, they should. What the science suggests is that the antibody response, the immune response you get from the vaccination is actually more robust and lasts longer than that of a natural infection. So we're advising across the board, even if you have had COVID, because we're now seeing people who have had COVID back in March, April, and getting a second episode now. Generally less severe, but we are seeing people catching COVID. They probably have some degree of T-cell defect, I think, because the majority of people will probably not catch COVID once they've had it.
Can I still infect someone even if I take the vaccine?
No. It's not a live vaccine. It's not a live vaccine. It's just a component.
So if I take the vaccine, I can just be moving around freely, even without wearing mask. Can I infect someone?
No.
Even though I take the vaccine? No,
you shouldn't. You shouldn't. So it's live vaccines that can transmit. So for instance, polio, when we were giving oral polio vaccine, that's a live vaccine, and we were having children that were coming up with manifestations of polio because of the polio strain that was circulating as a result of vaccination. But no, this is just a component, a small component of the virus. It wouldn't cause active disease at all. And then the second thing to say is, even if you have the vaccine, you have the 2 doses. The first dose will give you an antibody response about 2 weeks later. The second dose will give you a more robust antibody response a week later. So even if you were to receive the vaccine, it will take up to 6 weeks, 5-6 weeks before you can actually consider yourself to be immune to COVID. It's not an immediate after the first dose.
What is Nigeria doing? Or give me the update so far, if Nigeria is doing anything regarding research and trying to develop her own vaccine, perhaps suitable for our own environment, and yes, suitable for our own environment and our own structure.
So I know there are a number of streams of work going on, but in terms of getting our own vaccine, Nancy, even if we had a vaccine today, it will have to go through clinical trials, phase 1, phase 2, phase 3 clinical trials. By the time that's done, the world will be saying, oh, COVID, it's in Nigeria alone. There's no time for this. There needs to be a sense of urgency. There needs to be a sense of urgency. So we cannot sit down and say we want a Nigerian vaccine. And by the way, okay, May and Baker, there's this arrangement for the vaccination, but mRNA technology is highly high. It's not normal technology that we have at the moment. We would not be fair to ourselves if we say that we are going to develop our own coronavirus vaccine. The only way you can do that is, let's say, some of the Indian generic companies, for instance, that are currently being involved in the AstraZeneca manufacturing plant in India, where a lot of the vaccines will be produced. Let's say the Indian generic companies decide to come and set up shop in Nigeria because of the population we have and our position, then that's possible. But even then, it's faster to just bring in the vaccines and give people the vaccine and give them the protection they need.
What are the possible side effects? Have you done your study, or your tax was done study, and those that have taken it abroad? I know, I think December 14, the first person in the US took it early in December, just before I went to for the break. The UK woman, Madam Margaret, also took the first one, a 90-year-old woman. So have you been able to study and get feedback in terms of the side effects of
actually they're turning out to be very mild side effects. The commonest side effect is actually an injection site inflammation, so pain and discomfort around the
like
site.
The one that happens when
if you have any other injection. Yes, so that's the key. That's the most common side effect. There are other side effects. You might feel a little bit fluey for a day or two because it's inducing an immune antibody response, and antibody response usually comes with certain inflammatory markers. They call them cytokines, and this is what gives people fever. If you get malaria, it's usually a cytokine response. So you might feel a little bit fluish for a day or two, but that's usually mild. In fact, if you have that, it's more likely that you're going to have a more robust antibody response to the virus. What we're trying to do is to get the body to identify. So let's say you have an enemy, and you just get a piece of the enemy, maybe just the head, and you show it to your megats and say, see this person, this is the picture, this is his head, this is what he looks like. If he comes in next time, recognize him. The moment they see that person again, they will recognize him. So that's what we are trying to do with the vaccine. We're trying to get the immune system to recognize what it looks like and to develop enough antibodies, or at least be ready, so that when the coronavirus goes in, the virus doesn't have a chance, it cannot replicate. So that's the purpose of vaccination.
Due to the surge of this second wave of the virus, should Nigerians be expecting another lockdown?
So the appetite for a lockdown is really not there, Nancy, but I think this,
because the cases are rising.
The cases are rising, but
at least
but the answer,
yesterday, at least in the last few days, I'll be hearing in my house on the road, wow, 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 wow. And when I look through the window, I'm seeing ambulances, like wow, 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 siren, wow, wow, like.
So what I would say is the decision will be made by the numbers.
By the numbers.
Yeah, and by what's happening.
But the numbers are rising.
The numbers are rising, but as I keep on saying, most of us don't want a lockdown because we know the impact it will have on the economy.
Livelihoods.
The livelihoods, etc. So what I usually do is I turn the question around. I ask people, do you want a lockdown? No. If you don't want a lockdown, this is what you need to do to stop a lockdown. Now is the time to stop a lockdown by changing our behavior. If we don't change our behavior, the virus will spread, and our health system will get overwhelmed. And Nancy, if our health system gets overwhelmed, the worry is not just the people catching COVID and dying. No, it's the people that will die from their malaria, from their diabetic complications, from their kidney problems, from their hypertension, because they cannot access medical care. And that's when the decision will be taken out of our hands, because it will then become inevitable. We cannot afford to reach that state. I'm really pleading with the public. If you think COVID is not real, go to the hospitals and see how people are struggling. And it's a very painful death. It's the equivalent of suffocating because you are not able to take enough oxygen. It's not a death that you want.
So you just see death coming and you know that you're about to die. Yes. You're just suffocating.
You're suffocating because even though you might be on oxygen, it's not enough. It's not going in because your lungs have been completely taken over by the virus. It's not a pleasant way to die. And even if you don't die, the suffering associated with it, it's completely unnecessary. This is a preventable illness, and that's why when people say to me, well, what about people dying from malaria and dying from TB, etc.? Yes, these are problems that need...
We have more people dying from those ailments?
Absolutely true, but at the same time, sorting out the malaria problem in Nigeria is not going to be something that can be done within weeks or months. Nancy, if we had followed the non-pharmaceutical interventions back in March, April, this thing would have been over by the end of July, max. And here we are, January 2021.
Would it have been over when the borders were open, or now people are coming from UK and US, and the big men, their children everywhere coming in, everybody came in for December.
But that's why we say non-pharmaceutical interventions. If you come in from the UK with your virus, you follow our protocol, you stay at home, you wear your mask, you don't interact with people until the day 7. You go and have a test, you're cleared. You're not going to transmit it to anybody. But if you don't, if you come in and you go for a wedding, just like we've had situations where people have come in from outside the country, they have not been following our protocol. There is nothing like a short-term visit to Nigeria. Whatever you do is 7 days plus, because we expect you to self-isolate at home, not to go for your wedding for at least 7 days, have a test, and then after that you are free to go into the community. They come in, they do whatever they are supposed to do, and they end up transmitting the infection to others. But if all of us follow the non-pharmaceutical interventions, the virus is not going to fly. It will not open your door and get into your house. It's not going to fly from you to me. Somebody will have to transmit it. So if we follow those non-pharmaceutical interventions, Dubai is open. Flights are going in, all their shops are open, but you wear a mask. If you don't wear a mask in Dubai, you go out, you're fined.
Now, just as we end this program, because in fact my producers are talking to me, oh, the time, but I also needed to extend this conversation because, like I said earlier, this is the first show I'm having this year, and what a topic, because I needed to speak about this, to know at least the outlook for the year before we begin to talk economic numbers and all of that. Let me go back to the question I asked, and let me bring it this way. That seeing that there's the option for Nigerians to get vaccinated abroad, if the vaccines are not going to be coming in quite early, and those that may have access to get it abroad are the big men, the elites among us, would we still see a sense of social responsibility when all the big men and big women have gotten theirs and leave Nigerians to their fate?
I'm afraid the big men and big women will not get the vaccine unless they have some residency rights at the moment in those countries. So there's nothing like vaccine tourism at the moment. Anybody you see having a vaccine outside the country, the likelihood is they are either resident or they have the passports or they have some sort of right. At the moment, countries are prioritizing their own citizens, quite rightly so. And that's why we need to prioritize our own citizens as well. Nancy, the number of people that have died from COVID that could have gotten onto a private jet and go to UK or the US for their treatment, but when we were locked down, they couldn't. There were no flights going out. So we were left with a health system that we had to manage. And that's why it's so critical that this time around we learn. We learn from our mistakes. We know that our health infrastructure really needs to be strengthened. We really need to sort it out once and for all. We shouldn't be caught napping again.
Has our health system improved, or health infrastructure improved as a result of COVID-19?
So one positive thing that I can say is nowadays, if you go into the budgeting system, let's say 2021 for instance, and you say Abuja declaration, you really need to put this percentage of money into health, you have fewer people arguing, because we know that health is wealth. It's fine to build roads, infrastructure, etc. But if you have a sick population, you're not going to have development as a country.
Can you really put a cost, since we've been fighting this? You may not be the best person to answer this question, but attempt to answer. In terms of the cost spent so far, how much we've spent so far in terms of fighting COVID. I know there's COVID at the time. NNPC and its partners did theirs in terms of infrastructure and all of that. Can you just give me a sense of it?
I don't think it's let's have a look at this. So from the state side, we gave each state at least 1 billion naira. We gave Lagos 10 and Kano 5. So we gave them about 50 billion naira. And we've been talking to them because the majority of them have sat on the money. They haven't really spent it. Maybe hoping that COVID will resolve itself. But it's a good thing that they have the money, because it means now that at least we can say to the state governors, and some of them have been doing very well, like Governor Okowa and his team for reagents, etc., is still going through. The operational side, we still have funds for the operational side, so we're giving money to the teaching hospitals and the federal medical centers, a certain amount per patient, and I think we've only given about 30%. We don't want the money to run out, so I can tell you.
How about the allowances to the frontline health?
So allowances do not come from the PTF side at all. They came direct from the federal government, and that negotiation was only for 3 months, and the money was so huge that the federal government could only pay for 3 months, and since then there needs to be further discussions or negotiations before that can continue. I know the UN single basket, they had funds of up to, I think, about 50, I might be wrong here, 50 billion or so, but most of it was to bring items in, and they have been very helpful. COVID have been exceptional, to be honest, despite all the problems that happened with the palliatives. Without COVID, I can tell you, we wouldn't have been able to open the airports that we did. Until this day, if we need to do something fairly rapidly, like sorting out the oxygen situation in Abuja, for instance, it was just one phone call to COVID, and they sorted it out for us. And I think that's the advantage of government really working very closely with the private sector, because you get that advantage of efficiency when it comes to the private sector. Overall, I think the impact on the economy has been huge. It hasn't been because of the money being spent on COVID, no. It's been because of the loss of employment. At some point, about 40%, when we locked down, about 40% of the Nigerians lost their jobs at some point in time. So the impact, but then it's not just Nigeria, it's across the board. That's why we are now in a recession. But that's why we need to sort this COVID problem, so that we can all get back to normal and start growing our economy again.
Thank you very much, Dr. Aliyu, for speaking with me. Definitely the interview stretched, so my director and producers, bear with us, but much needed. Thank you very much, Dr. Aliyu.
It's a pleasure, something else? Yes, so I just wanted to say that very quickly, travel is very essential, just for people to know. If you do not need to do a test on your way out, check with the country, check with the embassy. If you don't need to do a test, please don't do it. It's a waste of your money. And if you do need to, please do not use touts. Do not get fake certificates, because we are going to start arresting people sooner or later.
Okay. Thank you very much, Dr. Aliyu.
Thank you very much, Nancy.
I've been speaking with the National Coordinator, Presidential Task Force on COVID-19, former DG, National Agency for the Control of AIDS, NACA, that is Dr. Sani Aliyu. That's the much we can take on today's edition of the program. I hope we've been able to create that background for this year. As I end the program, don't forget to wear your mask. Mine is here. So wear your mask. Don't put it like this. Don't put it like this. Wear it complete like this. Sanitize your hands and wash your hands. I am Nancy Nnaji. I will see you all tomorrow. Bye now.